Welcome student in another session of chapter 8. In this we are going to discuss about drugs, smoking and alcohol abuse. Drugs. Commonly abused drugs are opioids, cannabinoids, coca alkaloids. Opioids. They bind to the specific opioid receptor in our central nervous system and in our gastrointestinal tract. Examples are morphine, heroin, brown sugar. Morphine is extracted from the latex of poppy plant, that is Papaver somniferum. It is sedative and painkiller and useful in many surgeries. Heroin is a smack or diacetyl morphine. It is white in color, odorless, bitter, and crystalline compound. Usually, it is obtained by acetylation of morphine. It is taken by snorting and injection. Heroin is a depressant and slows down body functions. Cannabinoids, the other type of drugs, they interact with the cannabinoid receptor in our brain, generally taken by inhalation and oral ingestions. Natural cannabinoids are obtained from the inflorescence of the plant named as Cannabis sativa, which is hemp plant. Its flower tops, leaves, and raisins are used to produce marijuana, hashish, charas, and ganja. They affect our cardiovascular system that leads to increasing our breathing and blood pressure. Cannabinoids are abused by some of our sports persons. Next is coca alkaloid or cocaine, which is coke or crack. Coca alkaloids are obtained from coca plant named as Erythrozoilum coca, and it interferes with transport of neurotransmitter dopamine. Cocaine is usually snorted. It stimulates our central nervous system, which produces euphoria and increase energy. Excessive dosage of cocaine causes hallucinations. Atrofa, belladonna, and datura are also hallucinogenic plants. Drugs are used as medicine to treat mental illness like depression and insomnia, but they are abused, resulting in impairment of physical, physiological, or physiological, psychological functions. Next comes the smoking. Tobacco has been used by human beings for over 400 years. It is smoked, chewed, or used as a snuff. It contains many chemical substances like nicotine, which is an alkaloid which stimulates our adrenal gland to release adrenaline and non-adrenaline hormones, and that leads to increase in our blood pressures and our heart rate. Smoking causes cancers of lungs, urinary bladder, throat, bronchitis, coronary heart disease, gastric ulcers, etc. Tobacco chewing causes oral cancer. Smoking also increases our carbon monoxide content in the blood, and that reduces oxyhemoglobin, and this will cause deficiency of oxygen in body. Next comes the adolescence and drug or alcohol abuse. Adolescence is a period and a process during which a child becomes mature in terms of his or her attitudes and beliefs for effective participation in society. It is a bridge linking between the childhood and the adulthood. It's a period of about 12 to 18 years of age. It is very vulnerable phase of mental and psychological development, and it causes the addiction towards a drug or alcohol. So what are the causes of drug alcohol use in adolescence? These are curiosity and experimentation, need for adventure and excitement during this stage, then to escape facing problems, The cause of drug abuse could be of stress from pressure to excel in academics or examination, television, movies, newspapers, internet, etc., and or unstable or unsupportive family structures and peer pressure. So this could be the reasons, causes for drug or alcohol abuse in adolescence. Addiction. It's a psychological attachment to drugs and alcohol. It is because of the euphoria or a temporary feeling of well being. With repeated use of drugs, the tolerance level of the receptors increases. Thus, the receptor respond only to a higher dosage, and that leads to greater intake and addiction to the drug or alcohol. The other cause is dependence. The tendency of a body to manifest a characteristic and unpleasant withdrawal syndrome if regular dosage of drug is abruptly discontinued. This results in anxiety, shakiness, nausea, and sweating. Dependence leads to social adjustment problems to an individual. Now let's learn about the effects of drug alcohol abuse in an individual. An individual shows a reckless behavior, vandalism, and violence. Coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. Drugs mixed with alcohol may cause death. It causes damage to our nervous system and liver cirrhosis. Liver cirrhosis, you can see on your screen the death of the tissue, damage of the tissue of our liver, that is because of the alcohol consumption. Then mental and social distress to a family and friends. Lastly, the effect is social problems like stealing and spreading of infectious disease like AIDS, hepatitis B, etc. Use of drugs and alcohol by a pregnant woman can affect the fetus, fetal alcohol syndrome, which is FAS. You can see on your screen the FAS. The fetus with FAS shows minor ear abnormality, indistinct philtrum, microgenthia, thin upper lip, then low nasal bridge, short pulparial fishery, flat midface, and short nose. The addiction towards the drug and alcohol will also lead to loss of the sexual drive, and misuse of drugs by athletes like narcotic, analgesic, anabolic steroids, certain hormones to increase the muscle strength and bulk to promote aggressiveness, specifically in the athletes. What are the warning signs of drug or alcohol abuse in adolescent periods? First one is drop in academic performance and absence from the school. The second one, if an adolescent shows a lack of interest in a personal hygiene. Third warning sign is withdrawal and isolation from the peer group or from the friend circle. Last one is depression, fatigue, aggressive or rebellious behavior. So these are the warning signs of drug alcohol abuse in an adolescent period. They may show change in the sleeping and eating habits, fluctuation in weight, appetite, loss of interest in his or her hobbies, and finally deteriorating relationship between family and friends. Now let's learn about the side effects of anabolic steroid abuse in males and females. It causes acne, increased aggressiveness, mood swings, and depression. It reduces the testicle, breast enlargement, decreased sperm production, premature baldness, kidney and liver dysfunction, and finally enlargement of prostate gland that may lead to prostate cancer in males. In females, the side effects are masculinization, increased aggressiveness, mood swings and depression, deepening of voice, abnormal menstrual cycle, enlargement of clitoris, and excessive hair on face and body. Severe facial and body acne, premature closure of the growth centers of the long bones resulting in stern growth. These are the side effects of steroid abuse in males and females. How to prevent and control such abuse? Avoid undue peer pressure. Education and counseling of a child. Help from parents and peers could help the child to prevent it from such kind of abuses. Looking for danger sign. If such signs are, if someone detects such warning signs, it can be prevented. Seeking professional and medical help such as psychiatrist, de-addiction and rehabilitation programs would help in preventing and controlling. Thanks for watching.